Hey guys, I hope everybody's having a little rainy day, but you're staying healthy. My name's Dr. Moore, owner of School Performance Physical Therapy. We're going to talk about what you should not do with knee pain. I often talk about and write in blogs and on our email blast that it's really important to understand what you should not do as well as what you should do. So we did one on back pain the other day and got a lot of questions about it, so I figure we're going to do kind of a little series on what not to do. So today we're going to focus on the knee and what you shouldn't do with knee pain, because again, what you shouldn't do is just as important as what you should do. And most people automatically, the minute anything hurts, they stop, they just cut off all activity. And really, this is actually one of the worst things you can do. And unless you had a traumatic injury where you fell or you had an accident, then obviously that would require some rest. But outside of that, you need to be doing gentle activity, and that's going to help you actually get better. But a lot of times what irritates an injury is things that you're doing repetitively that continue to irritate it. So one of the things that we're going to talk about is just knee positioning and things like that. So if your knee hurts, and this isn't a trauma, this is your knee started to hurt gradually. What you shouldn't do, first of all, is you should not wear flip-flops or walk barefoot. So if you're suffering with knee pain, the first thing you change is your footwear. Being barefoot gives you no shock absorption. Even being in these flats that I'm wearing, not really great for knee pain. So you want to make sure you're in a supportive sneaker. That's super important to make sure that that is going to provide some cushion and allow for that knee to have an extra bit of shock absorption. As you walk or run or go up the steps, that shock is going all the way up from the ankle to the knee to the back, and so on. So it's important that you have a supportive pair of shoes on. Another reason is those shoes are going to help your foot stay in correct position, and however your foot is positioned also affects the knee. So be aware that those misalignments, because you are not wearing proper footwear, will affect how that knee is aligned and how that knee is feeling. So first thing that you don't do is go in bare feet. You really want to wear shoes, and I'm talking around the house, I'm talking walking outside. Make sure that you have that supportive shoe wear on. The second thing you want to do is you don't want to have your knee wobble. So the one thing that I continuously see when we're treating knee pain, and I'm not talking again about traumatic knee pain, we had an accident, is a lot of inward motion. So you want to pay specific attention to this. Like when you go to sit down, your knees, and I'll do it a little bit more exaggerated so you can tell, but your knees will start to come in like this. This is very common to see. And again, it's not that gross, it's not that evident, but if you watch your knee should go forward. And when you generally have knee pain, or even before knee pain, it may even have been one of the reasons you started to get knee pain, you're going to start to have your knee collapse. And that's something that you want to watch going up and down the steps, going from sit to stand, any type of motion where you're stepping up or you're moving that knee. You want to watch that you're not wobbling, that you're not bringing that knee inward. So really look down periodically even when you're walking and make sure that you're not bringing that knee inward. The next thing, the third thing that you don't want to do is you don't want to limp. This is very common with knee and ankle pain. Oh, I'm just going to take the pressure off today. I'm just going to hobble around. That's completely the worst thing you can do, because you're going to wind up using your hip, your back, your knee, your ankle in the wrong manner, and you're going to cause yourself more pain. And a lot of times this limping that starts off just for today can extend and actually change how you walk and cause you much more pain down the line. So even if you have to slow your pace down or take smaller steps, you don't want to limp. So the things you can change with how you walk are slowing down, taking smaller steps, not going up or down with the bad knee when we're going up and down curbs or steps, Those types of things you can do without affecting the knee, without limping, without making any changes to the overall health of your lower extremity. But don't start limping, don't start hobbling around, because that absolutely can be detrimental to what you are going to eventually, the healing process of the knee. If you or someone you know is suffering with knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.